I'm Robert, and I'm 71. I was born in Canada, came to San Francisco when I was 3, and I live in Santa Rosa now. I do professional picture framing, and I do it for friends, basically. I read, drive. I like to go on little excursions here and there. I got a dog that thinks he's a cat. You know, I have friends I visit, and little social life. I have colon cancer and liver cancer. I had a buddy of mine with me just because you have to have a driver. And he was there when the doctor came in and said, and I said, well, you know, I just didn't see it as like a panicky kind of a thing. When I first met Dr. Kaiser, I thought, Jesus, I don't believe this guy. His lab coat is just pristine and starched, and he's got the shock of white hair.
I'm Dr. Wayne Kaiser. I'm a hematologist-oncologist. When I first met Bob, the first impression I got is what a wonderful guy that he is. He's an unusually interesting and gregarious fellow. We had a prolonged question and answer session in a good way. One of the most important questions or concerns is, what are your goals? What do you want to get out of this? And so one of the goals was to be here. So in other words, I don't want this cancer to become my life. I want to continue my life. The treatment plan for Bob was to come in every 2 weeks, and we would have what I would call a hi, how are you doing? And the hi, how are you doing is important. How are you doing is really important for me to understand. Is it helping? And is it having any significant side effects that we have to deal with? Finding out his daily life, his quality of life, and then moving on to the treatment.
I've been treated very well. I feel myself to be very fortunate. I put myself in their care and in their hands, and I trust them. Everybody's very humanistic. You know, it's not like clinical. I feel like something's being done.
Fatigue, weakness, poor appetite, weight loss, these are the things of daily life that cancer pull down. And when we do treatment, I and Bob, should expect those things to at least stay equal but improve over time. That's the definition of success. And so we've had success in Bob's case with that.
So I was down to 184 and I'm back up to 200. And when I hit 200, boy, I felt like going out and eating an entire cake all by myself. I felt great. I really appreciate everything they've done and still are doing, of course.
In medical school, we were taught, do not get emotionally involved with your patients. That's crazy. You cannot help but get involved, meaning connecting with people, because they are people like your own family. I'll never forget the look on Bob's face, the big grin that evolved into a huge smile when I gave him the first results after his first initial set of treatments that told us that his cancer had stopped growing and was in the shrinking mode.
I'll never forget my time with St.Joseph Regional Cancer Care. I'll never forget my oncologist, Dr. Kaiser. I won't forget the support of my friends. I'll never forget my pal, Rocky. I am a fighter.